Good evening, everyone. Hope all of you are well and safe at home. Everyone is healthy and doing well. You are editor of Aesthetic Medicine India and you are watching me on the Aesthetic Medicine India digital series. This is our endeavor to bring to you the best of knowledge from Indian aesthetic industry, from technical expertise to clinical and business related topics. We will be covering a lot more and bringing you some expert insights into all of these subjects. So please stay tuned with us, follow us on our social media handles, and for more information visit us on our website aestheticmed.in. That's aestheticmed.in. In this series, joining us in this series today is Dr. Aparna Santhanam, a holistic clinical dermatologist, and how to get yourself trained appropriately in as clinics, aesthetic clinics across India are fighting a brave battle against the repercussions of lockdown and are also putting up every precaution in the book for to fight against coronavirus. It is time for us to take a stand on what is the way forward in aesthetic medicine and how are we going to win the customers, the clients' confidence back. So we're going to discuss all this and much more with Dr. Aparna. I will be quickly adding her in this conversation. So please stay tuned with us and also invite your friends and colleagues from the industry to join us in this conversation. Right. Hello, doctor.
Hi Kanishka, how are you?
I'm doing very well. Thank you. How about you?
I'm doing fine as well as we all can be with this lockdown enforcement now entering almost the fourth month. So,
Right. So that's actually a very positive way of thinking at it, looking at it, being as well as we can be in the current situation. So
right.
I think what this scenario is allowing us to do is a lot of introspection and learning on our part. Every one of us is trying to upgrade ourselves in whatever ways are possible, and that is why we wanted you to speak especially on the whole training aspect for
Sure.
dermatologists. But before we get into that, I want to know from you, what are the prerequisites of a dermatologist to start practicing aesthetic medicine? Is there any parameters that they need to have in their mind, or are there any prescribed parameters before a clinical dermatologist or even a new dermatologist tries to step into the field of aesthetic medicine?
Sure. Just bear with me for a couple of minutes because I'm going to go back a little bit in history and talk about my own journey just to give a little
Sure.
insight into what it was like. So,
Right.
way back in 2002, 2003 is when cosmetic dermatology was still in its nascency. And there were
Yeah.
some early birds who already started it, Dr. Madnani, Dr. Jamuna Pai. These were people who had started doing some degree of aesthetic medicine, but it was nowhere near as widespread as what it is today.
True.
And that was a point at which I had joined Kaya Skin Clinic actually as a clinic doctor. And there wasn't even a formal training program. Actually, Kaya had opened these two clinics and they just put doctors in.
Yeah.
And whichever was the company which had sold the laser at that point to Kaya or which had sold the peels was doing some level of training. But
Yeah.
once I got in, what we did was we put in a formal training program for dermatologists and we kept improving upon it.
Okay.
So, one of the things I'd like to tell people who are listening is that for any branch of dermatology, and that includes aesthetic medicine, first, sound, deep knowledge of dermatology is important. So, it's really
Right.
important, even if you are getting into aesthetic medicine, to have a clear cut and deep knowledge of clinical dermatology and to keep improving upon that because until you understand skin in all its entirety, you cannot really hope to enhance the skin from where it is.
Right.
And the second thing that I'd really like to emphasize is when it comes to aesthetic medicine, developing what we call as a keen aesthetic eye is very important, which means also understanding, geometric and mathematical proportions of the face, understanding what defines cultural beauty in the areas where you practice. So, what is considered as cultural beauty in India may not be the same if you're practicing, let's say, in Japan or somewhere in Southeast Asia. So a
True.
little bit of understanding of culturally what is considered as the ideal of beauty, anatomical understanding, especially of the face in great detail, because you can't do procedures like Botox and fillers unless you know where your muscles are, where your nerves are, where your planes of the face are. If you're not aware of those details, it's difficult actually to be a good injector. So
Yeah.
basically, going back to your basics is very, very important. And these are not things that you have to wait for someone to train you. You can start reading up on these yourself, once you're an MD or a diploma dermatologist. Start
Yeah.
reading up and start perfecting these, what I call as your, bricks and mortar of understanding dermatology. And then you can look at what are the ways in which you can both formally and informally train yourself to become an aesthetic doctor. And today, luckily, 20 years down the line, there are both ways. You can do formal as well as informal training to become an aesthetic doctor. But a good
Yeah.
understanding of clinical dermatology, a good understanding of anatomy and physiology, a good understanding of the cultural aspects of beauty, and lastly, a very good understanding of the psychological makeup of the patient, because very often it has been described that aesthetic enhancement is like a drug, like any other drug, anything that makes us look better and feel better. Both as a patient and as a doctor, you develop a yen for it, and you have patients who constantly come back to ask for some improvement or the other. Now, as
Yeah.
doctors, it's our duty, apart from fulfilling their requirements, to also counsel them to see what underlies this need to constantly improve yourself. Sometimes you'll have the most perfect looking, in my opinion, perfect looking men and women wanting to change things about themselves. It's
Yeah.
important to counsel them, to get them to understand what underlies this need, because otherwise you might keep injecting or you might keep doing more and more lasers and you will not get patient satisfaction. So
Right.
until you have these four basic things under control, that is your stepping stone to actually entering the world of aesthetic medicine.
Right. So that is a very comprehensive list of that you have offered to us, and I'm sure doctors who are on the threshold of exploring this field should take this into consideration. You mentioned formal and informal training. So can you elaborate a little more on that, and also tell me, will informal training hold a standing for you once you start practicing?
Okay, so that's a really good question. See, a lot of the procedures that we do in aesthetic medicine, so anything that improves the appearance of the skin is aesthetic medicine. It's not
Yes.
necessarily only procedure forward. So, if someone comes with acne scars, or someone comes with melasma, or someone comes with pigmentation, even recommending the right kind of creams to them, understanding the products in the market that they are using, doing a very good cosmetic consultation is also part of aesthetic medicine. Now,
Right.
that is something that one can develop on one's own by just reading a lot, and I think it's really important for all dermatologists. We are at the end of the day in the field of beauty, and it's
Yeah.
important to know what are the products out there in the market, even if we don't prescribe them. To just give you an example, if you are a practicing dermatologist and a patient comes and tells you, I'm using a sunscreen from, let's say, a brand like Innisfree or a brand like Vichy, unless you know what that sunscreen contains, you can't tell them this will suit your skin or not suit your skin. So an
Yeah.
understanding and knowledge about products around you in your environment is important. When
Right.
I talk about informal training is usually, you do have a lot of representatives who come to you, or mailers which come to you outlining products that companies are producing. And these
Yeah.
could be in the form of chemical peels, it could be instrumentation like microdermabrasion, it could be derma rollers. And many of these companies which sell you the products will also provide either a training manual, or they
Yeah.
will provide you a 2-hour training video. Now, these are all informal methodologies of training.
Yeah.
They are not unuseful, is what I would say. They could be quite useful in their own way,
Hmm.
because a lot of medical colleges, especially the mainstream medical colleges, still don't offer any kind of formal training into cosmetic dermatology in the 3 years that we are doing our training. And we
Okay.
still don't have in India a single fellowship on cosmetic dermatology. So no institution is really offering a formal fellowship in cosmetic dermatology. So in that sense, all training today either is done outside of the medical colleges. The association, that is the IADVL itself, has some training programs for
Yeah.
which you can apply and sign up. And a lot of conferences, for instance, the CDSI or even the national conference, will have days of workshops, So they'll have a Botox workshop, they'll have a filler workshop, they'll have a laser workshop. So if you sign up for these workshops, then stalwarts in the field would come. They will talk about these, and they'll also do hands-on training.
Yeah.
And these are some formal and semi-formal and informal methods of training. There are also people today, like there are cosmetic dermatologists themselves who offer fellowship programs in the confines of their own clinic. So Dr. Madhuri Agarwal is one of them. She offers a full-fledged training program for graduated dermatologists to do a training in cosmetic dermatology. And there are others around the country as well. So the other option is to look for one of these and do a program. In our days, we had an old adage, Kanishka, which I just love, which is observe, watch one, do one, teach one, and that I find is still one of the best methods, which is work in a cosmetic dermatology setup. All of these doctors who've got big clinics and multiple clinics constantly take on, assistants, new graduates. So you work with them, they train you, you understand, and the advantage of a training like that is you not only get the hard facts about how to use these disposable materials and machines, you also get the softer touch, the soft skills, and when I worked training doctors, soft skills was something we would really emphasize, because this is elective medicine. It is not disease and treatment. People don't come to you in distress which you're treating. People with perfectly wonderful skin and hair come wanting to make it better. So it's important to have those skills to talk to them, to understand the hidden needs, to find out what is really bothering them, and then to be able to fulfill that. That is a skill and an art in itself, which you pick up when you work with someone experienced in the field.
Right. So, in terms of formal training, people don't have too many options in India, and it's the informal trainings that, when done correctly, are going to help you. And like you rightly pointed out, it's working with an aesthetic practitioner that is going to perhaps be of most valuable to you. But do you think that, given the way aesthetic medicine is evolving in India, and the awareness in patients themselves, and like you also mentioned, that people who already have good skin and hair are coming to enhance it for whatever reasons, maybe it's their job requirement or they simply want to look better. So the requirement is definitely there, the demand is on a rise. So shouldn't this be part of your medical curriculum itself?
So I think it will happen. It's happening in small ways in multiple colleges where someone with personal drive is pushing it. So I do know, and I don't want to take those examples, but there are examples of a lecturer who wants to actually come in and do it. I think, IADVL is the Association of Dermatologists and Venereologists, is doing a lot of work in ensuring that at least it features regularly in conferences. I suspect it's a matter of time before we will see some fellowships coming up, in each of these. And I think it will happen in conjunction with industry. So you will need the medical colleges to formalize the fellowship, and you'll need industry to participate, to provide the infrastructure and training, because a lot of institutions are still quite strapped for funds, and aesthetic medicine, the setting up of it is an expensive business. So while you have the expertise in training, you'll also need the infrastructure. So I think it'll be a combination between industry and educational institutions, along with the association stepping in, which will eventually achieve this.
Right, a multi-pronged approach is what we should be looking at. Also, doctor, this is one field that requires constant upgrading, because anyways, as medical practitioners of any sort, you need to constantly keep on learning, because so many innovations keep happening every day, and because it's a high demand sort of a space, even brands and pharma companies are involved so much in doing innovations. How does a practitioner then go about upgrading themselves? Are they relying only on brands to tell them what are the new technologies, what are the new scientific breakthroughs, or are there other means that through which they can do it?
So, I mean, honestly, 10 years ago, you would rely only on brands visiting you, but life has changed and there's been a paradigm shift, really. And I think most of us have realized this during the lockdown period. Is at an all-time high now. You like I'm sitting in Bombay, but even if you're sitting in a tier 2 town in India, you can easily access the latest indexed journals. You can access the latest indexed articles. It's very easy to go and find out what are the new technologies which are coming in. Let's say, for instance, in light therapy or hair removal therapy, what are the different kinds of fillers that are coming into the market. You don't need anyone to come and tell you. It's very easy to figure out what is available in the world. Then it comes down to what is available in India. And even today, if you look at it, even names of suppliers, everything is listed. It's in public domain. So it's no longer become the purview of you. The field has really opened up. The other
Yeah.
thing that I'm finding through lockdown is that knowledge amongst doctors is being disseminated much better. A lot of people are coming forward, holding these Zoom conferences, discussing, how is practice going to be in this post-lockdown period? What are the
Yeah.
new instrumentations which are coming in? So I don't think any doctor has the excuse today that you have to depend only on industry to educate you. I think
Yeah.
you can easily educate yourself as long as you have a smartphone and a good Wi-Fi connection in your hand. You can absolutely get access to any information. And even, training, it's very easy to reach out to people, not only in our country, but even in other countries. And
Yeah.
people write back, the world has changed now. So you drop an email to anyone, no matter how big they may be, they all tend to get back to you. So I
Right.
think the thirst for knowledge has to come from you, and that is something that's been constant through the years. The more you hunger for that knowledge, the more you'll find the resources. And today, luckily, the resources are at your fingertips. So, but I think what you mentioned about constantly needing to update yourself is very important. There
Yeah.
are not small changes, there are paradigm shifts that happen in cosmetic dermatology. It's
Yes.
almost like artificial intelligence or augmented reality. Today things are moving very fast. So
Yeah.
what we were doing, when you look at the first 5 to 6 years in India of cosmetic dermatology, the pace was very slow. Now it is absolutely accelerated, and we're in sort of geometric progression. So if you sit in your clinic doing the same services you did earlier, you could still survive. It's not that you can't, but if you want to be cutting edge, you really need to move with the times. And it's really very easy because all the information is out there. And there are so many groups. I mean, even within India now, there's MCAS. There is, there are associations which are regional. So you have a Maharashtra IADVL, you've got a Tamil Nadu one. There are tons of conferences which are happening every day. I mean, somebody had written on their Facebook page that one thing is the pandemic of COVID, second is the epidemic of Zoom conferences, and that's really true. In the last 3 months, we've seen an explosion of sharing of information.
Yeah.
And while you don't have to attend everything, it's very easy to pick and choose what you do want to attend, and it's important. Once you attend something, that should trigger a thought in your mind to go read more about it. It's not just that I've attended, I've listened, and I'm done. The
Yeah.
thirst for knowledge is to come, and the information is available there, and it's very important to update yourself. Not just physically with your skills, because aesthetic medicine, there is a craft and there is an art. So the
Yeah.
art is what you develop over a period of time with your aesthetic eye, but the craft is there for you to read, learn, understand, practice, and that's really, really important.
That is so nicely put. There is no dearth of knowledge for the eager minds. And right now, when the world is exploding with the whole internet boom and the Zoom boom, there is no excuse for you really if you are
No.
not able to update yourself. So you mentioned the whole way clinics are dealing with the COVID-19 situation. So we'll come to that in a bit. But before we get into that, I want to speak about the first step that an aesthetic medicine practitioner has to take if he wants to set up his or her own setup. So yes, it's a very cost intensive sort of a setup. If you want to start your own clinic, you need to have a lot many things going your way. So what are the
Right.
do's and don'ts that a new clinician should keep in mind before having her own setup?
So this is a really difficult question because it really depends on how large a setup, how large scale you want to go. So I'm
Yeah.
going to talk about an average, young person starting out who wants to invest a little bit but not invest a lot, because you're also talking about real estate costs. You're talking about the setup. I
Yeah.
think some things, you have to have a blend of machinery and disposable services that you do, so that
Yeah.
your investment is spread out over both. If you want to start 100% cosmetic dermatology practice, then I would highly recommend working with another cosmetic dermatologist for at least a year or two, familiarizing yourself with lasers, with the disposables like toxins, fillers, etc. Because if that is going to be your full scale bread and butter, you should only set up your own once you're entirely confident of what you want to set up and your skill in doing that. Because
Yeah.
once you run a full-fledged clinic, it's not a one-woman operation either. You're going to need assistants, you're going to need technicians, you're going to need practitioners. However,
Absolutely.
if you are one of those young people who wants to do clinical dermatology as well as aesthetic medicine practice, then I would recommend working with an aesthetic medicine practitioner for a short time. and
Yeah.
going in with your basic minimum, which is your get skills in microdermabrasions, derma rollers, understand chemical peels completely, and understand one laser system which can multitask. So you do have laser systems with multiple heads these days. So
Yeah.
hair removal as well as photofacials, those are for anti-aging and something for pigmentation. These are three things that laser systems, if they do at a bare minimum, that's good for you to start off with. And again, you've got multiple options today. So, you can ask around, you can go read reviews online, talk to senior dermatologists or aesthetic dermatologists because they would be able to give you the best advice. In
Right.
a lot of places, especially outside of Bombay, what I have seen is people even rent lasers, and a lot of, so what you can do is that you need not buy your own laser to begin with. If you rent a laser,
Yeah.
then that really helps you, because then you have to only pay for the days that you rent it. You can collect your patients all together, maybe 2 days of the week, and rent that particular laser system, which the company would be happy to provide to you. Bunch your lasers, do them, and then the lasers used by somebody else. And once you build up a critical mass of practice, you can bring in the other instrumentation as well. Now, things which are really high margin, like botulinum toxin and as well as fillers, entirely depends on
Yeah.
your skills. So please, improving your skills on injectability, on providing the right kind of look, not understanding how much to put in, not putting in too much. All that is really important, and that comes from attending multiple workshops. There are many company-run workshops as well as conference-run workshops. So sign up for the workshops, especially the hands-on one. Go ahead and talk to people who have done it before, train with other doctors, and that will really help you.
Right. So this is a very interesting bit that you just shared with us of renting laser machines. I
Yeah,
was not aware of this
yeah,
trend. So yeah, it is a cost-effective method of setting up
right.
your own establishment. I have a question related to your answer actually. Is it a wise decision to get guest doctors to come and attend your clinic? So, for instance, I'm not so very good at administering Botox. Can I have a consultant come over and administer those treatments?
See, honestly speaking, Kanishka, for a full-fledged MD dermatologist, I would not recommend that.
Okay.
Because, I mean, I'm just speaking from a completely practical perspective, that unless you're doing a group practice, where you've got someone who's a clinical dermatologist, someone who's an aesthetic medicine doctor, someone who's a hair transplant specialist, then you can divide your work. But otherwise,
Yeah.
if you're running your own single person practice, you invite another dermatologist to do advanced procedures, you do stand the risk of losing your patient to the doctor, because the doctor at the end of the day is in the same field as you. So
Right.
what I would really recommend is first make up your mind that you want to be in aesthetic medicine, then train yourself to develop the skill and then get into it. You could always call someone in the early days to handhold you, like a friend or a senior doctor could help you with that. But I would
Yeah.
not, as a business model, recommend that you get someone else to come into your services. A lot of general practitioners do this, they would call a dermatologist to come and do it. And today, even you have a specialty called, oculoplasty, which is
Yeah.
ophthalmologists who are doing plastic work around the eyes. They also do Botox and fillers, etc. So
Yeah.
they sometimes go to dermatologists or even plastic surgeons clinic to do something specialized around the eye. But
Yeah.
as a rule, I would not call them in to do your patients. It's better that you invest the time and the effort to develop the skill and do it yourself, because at the end of the day, every dermatologist who aspires to be an aesthetic dermatologist wants to run their own practice. And it's better to put in the effort in the early years rather than take shortcuts.
Right. Also, is it very important for dermatologists to demarcate their area of work? Like if you're doing clinical, you're only doing clinical. If you're doing aesthetic, you're only doing aesthetic?
Not at all, not at all. Because in India, like I said, there isn't even a formal fellowship. There
Yeah.
are no clear-cut demarcations. If you are the kind who can keep up your clinical dermatology and like to do a bit of aesthetic work, you've got complete freedom to do that. If you
Okay.
feel that your aesthetic work is increasing, by the day, and you want to focus more on that, you could scale down your clinical dermatology alone. I mean, it's actually, these are demarcations that we make. So to just give you an example, if I
Yeah.
have a case of melasma, I'm going to treat the person like a clinical dermatologist. I'm going to talk to them about sun protection. I'm going to give them depigmenting creams to use. Now, if that doesn't work, I might move to the stage of doing chemical peeling. If that doesn't work, I'll move to doing Q-switched NDR laser, which means I'm moving into the aesthetic arena. But I started off with a clinical dermatologist. And
Yeah.
then after doing all that, I might still maintain them only on topicals. So
Right.
the two areas constantly, blend into each other, which is why solidity as a clinical dermatologist with good clinical acumen is the basis of every practice that you do.
Right. Now coming to the question of the hour, how will clinics survive in the post-COVID situation? So, what are the changes that, as a clinician, you should be taking in terms of sustaining your business?
So this is, I think, really important for all doctors to, start thinking about,
Yeah.
because all said and done, the world is changing. I mean, the desire to look better will never go down. There'll never be a dearth of people who want to make themselves look better because the world is geared towards that. In fact, I read last week, there was a doctor in England who's getting a lot of calls about how can I have a better Zoom face when I'm, in front of the camera with lights on.
Okay.
So these are changes that are going to come constantly. But
Yeah.
we have to be aware that at least in the short term and the mid term, people are going to reduce doing things which require a lot of contact. And aesthetic medicine, by definition, is a contact branch of medicine. People come
Yes.
in, they have to be draped, you have to apply the services, and whatever you're using, lasers, etc., have a contact point with the skin. So people have to start rethinking, rather than do only instrumentation based practice, how can you now combine clinical dermatology with aesthetic dermatology, and also combine technology like teledermatology along with that, so a lot
Yeah.
of clinics will have to go far more high tech in their use of technology, in reducing the contact, so have fewer staff working with you. Maybe
Yeah.
start taking not only your appointments online, but your entire history, loading of the patient photographs, discussing, what treatment plan you want to put the patient on, starting
Yeah.
with some treatment at home itself before they even come into the clinic to do their services. Start spacing the services out more, which means a deeper understanding of pharmacology of topicals. So can you instead give them, let's say, 12% glycolic acid to apply at home and do your peels only once in 6 weeks, as opposed to earlier where you were doing it once in 15 days. Also,
Right.
the clinic itself, earlier the aesthetics of the clinic mattered a lot, and around the world, people had clinics which looked more like your comfortable living room with a lot of overstuffed couches and everything. Today, you'll want to have things which you can sterilize well. So, which means less fast, more minimalism.
Yeah.
Have a flow through of the patient which is very, very streamlined. Use as many disposables as you can, even if it is not so environment friendly, because you want people to feel more comfortable about coming into the clinic.
Yeah.
Reduce touch with surfaces, because on surfaces things can, the COVID virus stays alive for 72 hours, so you really don't want things on surfaces. Employ things like ultraviolet sterilization, even ultraviolet tunnels, so that people who come in feel completely comfortable that they're not going to pick up something else when they come in there.
Yeah.
And also there is a lot of guidelines which is coming in both from the government of India, from IADBL, and from institutions abroad, as to how to have a streamlined COVID practice, post-COVID practice. In fact, many of the hospitals are even having perspex, they're having perspex divisions between patient and the doctor at points of time where you don't need contact. But I think minimalism is going to be the keyword. Minimalism in the way you structure your clinic, minimalism in your approach to the patient, So even when you're planning a treatment program, more at home, less in the clinic. I'm not saying not in the clinic at all, because you do need to do some services, but we have
Yeah.
to start thinking of what can we transfer to an at-home service, which will keep the patient and the doctor comfortable, and maybe even develop services which are a hybrid of both. And I think it's going to require a lot of conversations, a lot of once we open up, seeing the openness of patients to come in, seeing their attitude, how many are willing to come, how many are not willing to come, how many people are okay to undergo services. And we'll have to keep reinventing ourselves in the post-COVID era. But in my mind, minimalism is really going to be the key.
Absolutely. Uh, and I think it is one great method of boosting the customer's confidence when he walks into the clinic and he sees how well appointed your interiors are, and the
Yeah,
precautions that you have put in place. That is going to be definitely a confidence booster. Doctor, I
absolutely.
have a few questions from the
Sure,
audience. With your permission, I'd like to take them up.
sure.
Okay. Shugs Z wants to know, do we have to go abroad for upgrading every time?
So, I mean, this was true a few years ago. I don't think it's so true today, because you do have some of the stalwarts in aesthetic medicine in India who go abroad regularly and come back and transfer that knowledge. I
Yeah.
would recommend looking out in the IADVL calendar for upgrade seminars and workshops, including hands-on workshops. Like I said, organizations like IMCAS, constantly do training once in 3 to 4 months. It
Yeah.
does make sense to go once in a couple of years at least to look at what are the latest things and to sign up for some hands-on workshop. But a lot is available online to enhance your knowledge, and you do have a lot of hands-on workshop which happen in India itself. The trick is to look at the calendar of all the IADVLs across the country and not just the calendar of whichever state you live in, and you will find enough workshops happening here itself.
Right. Doctor, any word of precaution that you think doctors should follow when they are doing hands-on training or are working with small groups for upgrading themselves?
So I think, in the post-COVID era, it's going to become very important, personal protection and protection of each other.
Yeah.
So using PPE is absolutely going to become mandatory. I think it's
Right.
important that we work in much smaller groups now rather than larger groups, which is
Yeah.
an advantage for young budding dermatologists because you get to do more hands-on. And I think it's also important we start using simulators, like they do in so many other branches of medicine. So you
Yeah.
don't actually need to work with live patients all the time. You can work on simulated models, especially for injectables and lasers. This is very possible, and we should encourage industry also to come up with more simulator models for doctors to work with. So
Right.
the more training becomes virtual, the better it is for everybody.
Yes, so it is definitely going to be an era of virtual reality for us post-COVID.
Absolutely.
And it's just a matter of time before the doctors are able to adapt themselves to this new methodology and find out new ways of engaging with their patients.
And also, very importantly, give your patients the confidence that you can do services coupled with home care. And if you encourage it yourself, it will increase your patient's faith in you, because the
Yeah,
more number of times you're going to call them, the more they're going to wonder, is it safe for me? But if you draw
yeah.
up a program where you give them enough to do at home, which is giving a considerably good result, coupled with a little to do in the clinic, everybody's confidence is going to grow, and so is everyone's mutual protection.
Absolutely. Doctor, before we wind up this session, I want to know from you, why have you added the word holistic to your designation? What does it stand for you?
So, I mean, this is just sharing personally. I worked for many years between 2002 to almost 2008 on exclusively on cosmetic dermatology, and I found that I was missing the clinical aspect of dermatology a lot. So I
Yeah,
actually started working. I started balancing my practice much more and started working more with clinical dermatology. And I also started exploring more traditional forms of medicine like Ayurveda and naturopathy, which have a lot to do with skin. And over the last few years, I've been working a lot with my patients on lifestyle modification. So in 2010, I wrote a book called Skin Deep, which was all about diet and skin. And I
yeah.
work a lot with my acne, with my melasma patients, with my autoimmune disorder patients on their diet and their lifestyle factors, in minimizing medication and increasing emphasis on that. And I've been
Right.
getting some really good results. So I found that over the last decade, from 2010 to 2020, my practice has become more and more about correcting imbalances and correcting some things with allopathic medicine and aesthetic medicine rather than rush in and only do aesthetic medicine first. So that's the reason I've added the holistic, because I think, especially now I'm finding during this lockdown period when I'm doing a lot more teleconsultations, this
Yeah.
approach is really good because people are at home and they're willing to adapt and listen more, and they're getting very good results. And I think in the last 1 month, I've treated almost without any isotretinoin, which is quite rare. If they were in the clinic, I would have definitely prescribed it. But it's so much easier to
Yeah.
work with modifications of diet, modifications of lifestyle, modifications of what you eat with what, and that's the reason I've put that in. And my interest in naturopathy has grown, and I found that there's a lot of synergy between dermatology and naturopathy, and it seems to work well in conjunction for patients. So that's the reason. It's just a personal thing. Yes.
That's fantastic, doctor. And this is what I was wanting to glean out of you. This is, I think, the um, your takeaways from all these years of experience of working with aesthetic dermatology, and thank you for sharing this with us. Before we go, one last thought, any word of advice for upcoming aspiring aesthetic dermats?
Yeah, I mean, I'm going to sound like an old broken record, but this is a really exciting field to be in. Every time you read something or you attend a conference, the possibilities of what you can rearrange in the human face is only increasing. But I
Yeah,
think it's really important to first realize that we're doctors, and the famous old adage of first do no harm still holds good. It's
yeah,
important that we not only fulfill our patients' desires, but also act as the compass of understanding why they were doing what they're doing, and doing a little bit of counseling, because these days we find a lot of mental health issues which are intermingled with this whole dysmorphophobia, the desire to change oneself, all come from a deep-seated mental health space. And I think it's
yeah,
important for dermatologists, especially young upcoming ones, along with learning all your hard skills of doing the procedures beautifully, to also pick up the soft skills of understanding why patients are seeking a certain kind of enhancement. Is it really what they're seeking, or do they have a much more deep-seated need which we need to fulfill? Do they
yeah,
need to also have some counseling with mental health experts? That's really important. The second is to constantly upgrade your skills. As we spoke, Kanishka, earlier, there is nothing static in this field. It's really important to
true,
keep learning, to keep growing. Aesthetic medicine practitioner is always a student. No matter what you've mastered, there are still things that you haven't mastered, and it's important to know what you may have done last year may have no value this year at all. So it's important to understand that. And I think it's the most glamorous field of dermatology, but I found that it works better if you tinge it with a little bit of humility. The best doctors in this field are the ones who still approach it scientifically rather than look at the glamour aspect. A
yeah,
lot of budding doctors are drawn to this field because of the glamour and the fame and the money associated with it. But it's still a lot of hard work, and it's
yeah,
important to understand that the responsibility on you is even greater as a doctor. When you take someone who's perfectly well and you do something on them, you have no margin for error there. So to keep that responsibility very strong in you, to understand that apart from a medical responsibility, you also have a social responsibility, that is very, very important.
true. Thank you so much for sharing all this with us, Dr. Aparna. It was lovely to have you on our session, and
Thank you so
we
much
wish
for
you all the
inviting
best.
me. I enjoyed it too. Thank you so much.
The pleasure is all mine. Thank you, ma'am.
Bye bye.
Bye bye.